Hey guys, so I thought we would take some time to look over the bones of the skull. Yeah? So I think the best place to start is where you would look at if you were looking right in the mirror, right? So it's the frontal bone. So we can see here, you can see, hopefully the light's not too bright. You can see the frontal bone. So probably the first thing you notice is the forehead, right? So the frontal squama, forehead. Okay, and squama, you remember squamous always means flat, so you're looking at the flat part of the forehead. And then as we move down inferiorly, there's two things we're going to notice here. So you see this kind of projection, right, underneath where the orbit would be. So remember, projection, anything raised, we can call a margin. So above the orbit means supraorbital margin. So that's what you're seeing here. So you can actually feel that on yourself. If you feel right above where your eyes are, you can feel this kind of this bony protrusion. Okay, something else you're gonna see this little opening here, this little hole here? Looks more like a notch over here. Those are supraorbital foramen. So remember we use the word foramen when we're really identifying any kind of opening. You're gonna hear that over and over again in A&P. Foramen. Whenever you hear it, think opening, okay? This is a foramen opening here, okay? So supraorbital foramen. Passage of blood vessels through here are really important, okay? So margin is important for protection of the eye. Okay, what else do we see? So in between right here, what joins the margins is the glabella, okay? So it connects the margins here. And then you'll also notice, these are your nasal bones here. You'll notice this kind of little line here. That is a suture. Remember, suture is what's connecting bones together, articulations. This is your frontonasal suture, okay? Frontonasal suture, okay? So those are all the features really that I'd like you to know for the frontal bone, okay? Let's move posteriorly. So I'm moving backwards. See these two guys, these two friends? These are the parietal bones, okay? And the parietal bones, they're pretty big. Like if you touch the whole top of your head, that's really what you're looking at. So your parietal bones here, bam, bam. Okay, these guys also, look how far down they come on the sides laterally. Okay, so they're big and they're paired because there's two of them. Okay. So what we notice on these guys is your sutures, okay? So you see this big crack that's coming across here? This head is not cracked open, right? This is what your skull actually looks like. So this is the frontal or the coronal suture. So the coronal suture joins the frontal and the parietal bones. Coronal, I think crown, and a crown would sit on the top of your head. So that's how you can remember that one, coronal suture. All right, this guy splits you into right and left halves. Now remember, before we learned that a sagittal cut, right, splits you in your right and left halves. So this is the sagittal suture, okay? So coronal suture, sagittal suture, okay? And then if we flip to the back, where we see these parietal bones, it connects to another bone down here, and it kind of looks like the Greek letter lambda. So this is the lambdoid suture, okay? So that's three, coronal, sagittal, lambdoid, one more on the side, on the flat part of your head. The other word for flat that we learned or squished is squamous. You remember like stratified squamous? So this is your squamous suture. It's a flat one that's on the side of your head, and it joins the parietal to the temporal, okay? So frontal bone, parietal bones, 4 sutures, and that brings us to the temporal bone, okay? So think of your temples, right? That's this guy. This is your temporal bone, okay? Well, what are some cool things we have here? What do you think that is? It's going into your ear, right? So that's the external acoustic meatus. External because it's outside, acoustic for ear. Meatus, remember, is like a canal or a passageway. External acoustic meatus, okay? So if we kind of tip him over and take a peek, so this bone is running inferiorly, okay, next to the occipital bone. Okay, so here it is, and you're going to see some features. Let me show these to you. So 2 things that you'll notice next to the external acoustic meatus are these like protrusions. So you see this one looks kind of rounded or mounded, and this one's like pointy and sharp. Sharp, S for sharp, S for styloid process. M for mounded, M for mastoid process, okay? What do these guys do? Well, they're the attachment site for ligaments and muscles. Anything that's kind of raised up is usually going to be an attachment site for muscles and things like that. Anything that's a foramen, vessels, nerves are going through it. So that's a good general rule. Okay, so mastoid, styloid, external acoustic meatus. What else we got on this guy? Notice what's attaching here, the mandible. So if I kind of pull the mandible off, you have a little like dip or divot. It's what we call fossa, okay? So this one is the mandibular fossa because it articulates with the mandible, okay? So the mandibular fossa. Okay, so I'm gonna throw this guy out. I mean, I'm not gonna throw him out and bring him back, but all right. So that's the temporal bone, okay? Oh, something else in the temporal bone is the jugular and carotid. Okay, so the jugular foramen and the carotid canal, those are where the huge jugular vein is going through to drain blood. And then the carotid canal is the carotid artery, which is delivering blood up to the brain. So obviously super important things. Jugular and carotid. So I always remember that the carotid, C comes before J. So it sits more anteriorly towards the top of the skull, and then the jugular is located more posteriorly to the back. Okay, so that's the temporal bone. So we did frontal, parietal, temporal. Okay, next one that's on the outside that we can see, I think, best is the occipital. Okay, so this is the occipital bone. If you feel the back of your head, that's what you're feeling. Okay, so the occipital bone. So you'll notice it has this huge hole or opening. What do we call a hole? A foramen, right? And this is the biggest one on your head, okay? So this is the Foramen Magnum, right? You really can't miss that guy. So the Foramen Magnum. All right, what else do we have? We have the Occipital Condyles right here, and that's what your vertebrae are gonna rest on, okay? So they're like these two little, do you see them? They're like two little pads here. Also, if you tip a little inwards, you'll see a little opening there, a little hole, yeah? And that's the Hypoglossal Canal. So what's the Hypoglossal Canal? So the Hypoglossal Canal, nerves run through it. It's a hole, it's an opening. Nerves run through it. And those are actually going to control your tongue. Okay. So I think that's it. Oh, I should also mention, do you see this that's coming up? This is the external occipital crest. So a crest is like any kind of raising. I think it's like swelling like a wave a little bit. So that's what you see here, the external occipital crest. Okay. Ends in the protuberance. Okay. What else moving forward? I think we should move into the sphenoid and ethmoid. So if I take this guy, okay, so look what I'm doing, because I think the best view is from the inside. There's my hand. Okay, so take this guy off and look down inferiorly. Okay, so this bone, right, this is the back of the head still. So this is the occipital, okay? But now we're like inside where the orbit would be and above the nose. Okay, so we see two very important bones here, okay? The sphenoid, here I'll kind of do the outline. He looks like a butterfly. And then the ethmoid is this little guy right here that's gonna go down through the nose. So let's do the sphenoid first, okay? So sphenoid, this, I told you it looks like a butterfly. Well, what does a butterfly have? Butterfly has wings, okay? And so this comes down right here. This is the greater wing, okay? The greater wing. It makes the posterior walls of the orbit. Orbit's where your eyes are. And then we have the lesser wing, and that's just right here, okay? You see? The lesser wings right here, greater wing, okay? And then something else that's really special in the sphenoid, do you see this little area here? I don't know if I can turn to the side. It looks like a little saddle for a horse. It's called the Sella Turcica, or Turkish saddle. Okay, and you can imagine a little man sitting in here with legs on each side, right? That's the Sella Turcica. Okay, now actually in real life, a man does not sit in there. What sits in there is the pituitary gland. You're gonna learn so much about the pituitary gland later, but that's not for today, okay? So the pituitary gland, endocrine gland that's gonna sit in here in the Sella Turcica, okay? And then one more feature, so occipital, frontal up here. So this is where I am, Sella Turcica. If you look anteriorly, you'll see two little holes here. That's the optic canal, okay? So that's where the optic nerve is gonna pass through, and it makes sense because it comes out towards the eyes, right? So it makes sense that we would have a canal there. All right, so that's good. So that's the sphenoid. And then this little guy up here is the ethmoid. This is the ethmoid bone, okay? And it's not that big. And it actually goes down like through where the nose is up here, okay? So imagine him kind of 3D. We're imagining him going downwards or going inferiorly. Okay, so what are some important features? Well, the crista galli is this raised portion right here. This raised portion right here, okay? And then down to the side where it kind of falls down, that is the cribriform plate, okay? He's been drawn on a little bit, but you can see raised and then comes down to the cribriform plate. And the cribriform plate has like these little like pokey holes in it, and those are the olfactory foramina. So foramina, foramen, hole, olfactory, nose, right? So those are where little neurons go that are for smell, olfactory neurons, okay? And you can imagine that because this is sitting right where the nose is. Yeah, so there it is. All right, so that covers everybody on the inside, I think, and the outside. So all we really need to cover is these facial bones up front. So this, we did nasal bones. If you look in the medial wall of the orbit, you'll see these like, do you see this little bone right here? Little bone right here. Those are your lacrimal bones. They're teensy tiny lacrimal bones, but they have lacrimal ducts here, and those are your tear ducts. So I always think lacrimal, I think tears, crying, and think where they are, right here. And they have little ducts, and your tears drain down. And you've ever noticed if you've ever cried really hard, your nose runs a lot? Look at the anatomical location of that. Yeah, so those are your little lacrimal bones, little nasal bone. And then this guy, do you see this guy in here? He's an unpaired bone right through the middle of the nose. He's the vomer, strange name, V-O-M-E-R, vomer. And then do you see these big guys in here? I like to refer to them as the boogers of the nose. These are the inferior nasal concha. Inferior nasal concha, inferior nasal concha, and they're little boogers. You also have middle and superior as well, but these guys, these are pretty large. Okay, and then these are your maxillary bones, here and here, okay? And you'll notice you have teeth that come into them, right? And those are your alveolar processes, okay? So this is an alveolar process. And what they hold, obviously, is your teeth. The bony sockets for your teeth are gonna be there. Okay, yes, okay. All right, and then the last guy that we have is the mandible, okay? So he's your jaw, right? Mandible. Okay, so he also has alveolar process, right? And those are also holding the teeth, but on the mandible, they're holding them for the lower teeth and not the upper teeth. Okay, now the first thing you probably noticed was this opening. What's that most likely called? A foramen. What's the other word for your chin? Mental. Mental foramen seems like a super good name, okay? Got a little shadow there for those guys. All right, let's turn him. Look at the side of this thing. Okay, some anatomical terms to tell us regions. The ramus, the mandibular angle, because it's turning, right? Angle, and then the body. This is the body of the mandible, and you can see where the mental foramen lies. Process. Okay. And then it comes upwards. And this guy, do you remember which bone he fit into before? He fit into the temporal bone, okay? He fit into the mandibular fossa of the temporal bone, okay? So this is the mandibular condyle. And then this one is the coronoid process, okay? And in between them, mandibular notch. So angle, notch, okay? One more feature, little teensy holes on the back, these guys. And if they're not the mental foramen, they're the mandibular foramen. Okay, so I think that about covers it. I hope I covered everything on here. Oh, you know what? I already see one more thing that I forgot. Ta-da! Of the maxillary bones, they have this palatine process up here, but there's actually another bone right here, the palatine bone. Yeah, okay, so this is actually a separate bone from the process. Okay, now I really think that's it. It's been a long day. So hopefully I got everything for you. I hope that helps for your quiz next week, quiz on Tuesday. Email me with any questions.